About the fetal circulation. The fetal circulation is different from that of adult circulation because in adult circulation the lung will be functioning where the oxygenation takes place. In the fetus, which is an intrauterine, the lung is not functioning, so the oxygenation takes place at the level of placenta. The placenta is the main connection between maternal and the fetal circulation, and umbilical cord also plays a major role. And this is a diagrammatic representation of fetal circulation, and this is a schematic representation. Let's see each of this. The placenta, which is meant for transfer of blood, oxygenated blood and deoxygenated blood from the maternal and the fetal part. From the placenta, it gives origination to the umbilical vein. The umbilical vein, which carries the oxygenated blood and becomes a part of umbilical cord, it enters the umbilicus and the fetus. With the help of umbilical vein, the oxygenated blood is carried to the fetus and it is supplied. It supplies a major part of the liver, and there is a connection at the level of liver. This umbilical vein, which carrying the oxygenated blood, gets communicated with the inferior vena cava, which carries the deoxygenated blood from the lower part of the body with the help of a special vein that is called the ductus venosus. And this is this ductus venosus, which is a connection between umbilical vein, which is carrying purely oxygenated blood, and inferior vena cava, which is carrying the deoxygenated blood. With the help of this ductus venosus, the blood gets mixed. So at the level of above the liver, we have mixed blood of both oxygenated and deoxygenated blood, and this mixtured blood enters into right atrium. The right atrium, which also gets blood supply from the superior vena cava, which is meant to carry the deoxygenated blood from upper part of the fetus. Once the right atrium gets filled with the help of an interatrial connection, that is a foramen, and with the help of this foramen, the blood from right atrium is pushed into the left atrium, and left atrium also get filled. During this atrial contraction, the right atrial blood also pushed into the right ventricle with the help of tricuspid valve. When the right ventricle get filled, the main outflow tract is the pulmonary artery. In adult circulation, this pulmonary artery reaches the lung for oxygenation, but in the fetus circulation, as the lung is not functioning, the artery from pulmonary artery get bypassed with the help of a special connection that is called the ductus arteriosus, which communicates with the descending part of aorta. And when the left atrium gets contracted, the blood from left atrium pushed into left ventricle with the help of mitral valve. From the left ventricle, the main outflow tract is the arch of aorta and descending aorta. With the help of aorta, the blood is supplied to all parts of the fetus, and there is a connection between the pulmonary artery and descending part of aorta with the help of this ductus arteriosus. Once the blood is supplied to all parts of the body, the venous drain fetal part is supplied with the help of aorta. The venous blood is carried with the help of umbilical artery, which again becomes the content of umbilical cord and reaches the placenta for oxygenation. And this is the whole explanation of fetal circulation. Let's see the summary of this fetal circulation. First, we have the placenta, which is meant for oxygenation and deoxygenation. From the placenta, the oxygenated blood reaches the fetus with the help of umbilical vein. The umbilical vein communicates with the inferior vena cava with the help of ductus venosus. Once the mixed blood from umbilical vein and inferior vena cava get poured into the right atrium, right atrium also receives blood from the superior vena cava, and once atrium is filled, the blood is transferred to left atrium with the help of interatrial foramen that is called the foramen ovale. Once right atrium is contracting with the help of tricuspid valve, blood is poured from right atrium to right ventricle. In the right ventricle, we have the main outflow tract, that is pulmonary artery. As in the fetal circulation, lung is not functioning. 90% of the blood from the pulmonary artery get bypassed with the help of a special connection that is called the ductus arteriosus, and it communicates with the arch of aorta. Once left atrium gets filled during contraction, blood from the left atrium is pushed into left ventricle with the help of mitral valve. From the left ventricle, the main outflow tract is the arch of aorta, and from the aorta, the oxygenated blood reaches the entire part of the fetus. Once venous drainage is carried, the venous drainage with the deoxygenated blood is carried with the help of umbilical artery, which again becomes the content of umbilical cord and reaches the placenta.